Hello and welcome. Today we're diving into a condition called Empyema, a serious lung disease that requires prompt diagnosis and treatment. Join us as we explore what Empyema is, what causes it, how it affects the body, and how it's managed. Empyema is typically caused by an infection, most commonly bacterial pneumonia. When pneumonia isn't properly treated, or when the infection is particularly aggressive, bacteria can spread from the lung tissue into the pleural space, the space between the lung and the chest wall. Other causes include chest trauma, surgery, esophageal rupture, or infections spreading from other parts of the body. In rare cases, fungal or parasitic infections can also lead to empyema. Now, let's understand what happens inside the body. When bacteria invade the pleural space, they trigger an inflammatory response. This leads to the accumulation of pus, dead cells, and other debris within the pleural cavity. Over time, this fluid can thicken, making it difficult for the lung to expand fully. In advanced stages, the pleura can become fibrotic, forming a thick, rigid peel around the lung, further restricting its function. This process can lead to significant breathing difficulties and other complications. Empyema affects individuals of all ages, but it's more common in older adults and those with weakened immune systems. People with pre-existing lung conditions such as chronic obstructive pulmonary disease, HOP, or bronchiectasis are also at higher risk. The incidence of empyema has increased in recent years, possibly due to antibiotic resistance and the increasing complexity of medical procedures. The symptoms of empyema can vary depending on the severity of the infection and the underlying cause. Common symptoms include fever, chills, persistent cough, chest pain, especially when breathing or coughing, shortness of breath, fatigue, and sometimes unexplained weight loss. These symptoms can often be mistaken for pneumonia, making early diagnosis crucial. Diagnosing empyema involves a combination of physical examination, imaging studies, and laboratory tests. A chest X-ray or CT scan can reveal fluid accumulation in the pleural space. Thoracentesis, a procedure where a needle is inserted into the pleural space to drain fluid, is crucial for confirming the diagnosis. The drained fluid is then sent to the lab for analysis to identify the causative organism and determine the appropriate antibiotic treatment. Empyema can be classified into stages based on the characteristics of the fluid and the degree of pleural thickening. The stages often include exudative, where the fluid is thin and free, flowing, fibrinopurulent, where the fluid becomes thicker and fibrin strands are present, and organizing, where a thick, fibrous peel forms around the lung. Correct staging helps guide treatment decisions. Treatment for empyema typically involves draining the infected fluid and administering antibiotics to combat the underlying infection. Drainage can be achieved through thoracentesis or chest tube insertion. In some cases, surgery, such as video-assisted thoracoscopic surgery at ventilation or decortication, may be necessary to remove the thick pleural peel and allow the lung to re-expand. Antibiotics are usually administered intravenously and tailored to the specific bacteria identified in the pleural fluid. Preventing empyema primarily involves promptly and effectively treating pneumonia and other lung infections. Vaccination against pneumococcal pneumonia and influenza can also reduce the risk. Individuals with risk factors, such as chronic lung disease or weakened immune systems, should be particularly vigilant about seeking medical attention for respiratory symptoms. The prognosis for empyema varies depending on the severity of the infection, the patient's overall health, and the timeliness of treatment. With prompt diagnosis and appropriate management, many patients can recover fully. However, delayed or inadequate treatment can lead to chronic lung problems, sepsis, or even death. Current research is focused on developing new and less invasive methods for draining infected fluid and preventing the formation of pleural peels. Novel therapies, such as intrapleural enzymes, are also being investigated to help break down fibrin and improve lung function. Thank you for joining us today. We hope this information has been helpful in understanding empyema.